Good afternoon, everybody. My name is Mike Dowling. I'm the President and the CEO of Northwell Health, and I want to welcome you to this special event. We are going to begin with a brief video that's going to play now, and it shows the vaccine arriving this morning. So why don't we show that video, and then we'll get into the program. Okay, thank you. A week ago, we had a very, very special event when we were fortunate enough to have the first person receive the vaccine in the United States. That was the Pfizer vaccine. And that process has worked well during this week. We have already vaccinated about 6,000 people. And today is another special moment because today and now is when we're going to do the first vaccination with the Moderna vaccine. As you can see, and as you saw from the video, the vaccine arrived here this morning. And the vaccine is a little different than the Pfizer vaccine. It still requires 2 doses. While the Pfizer vaccine requires you to get the second dose 21 days from the time you got the first one, this one has 28 days. The second dose is going to be given on 28 days. It also has to be stored, but not at the temperature the same as the Pfizer vaccine. It can be at regular refrigerator temperature, which is -20. And so what we're going to do now is proceed with the first vaccination with the Moderna vaccine here at Northwell. And the person who will be getting the vaccine is Arlene Ramirez, right here to my left. Arlene is the Director of Patient Care Services here, Franklin, in the Emergency Department, a person who's been with the health system for quite a while, a very expert nurse. And giving the vaccine is the same person who gave the vaccine, who administered the vaccine last week to the first person, and that's Dr. Michelle Chester. So without further ado, we will proceed with the vaccination. And then once that is concluded, Arlene is going to talk about the experience and anything else that Arlene wants to say. She says she has about a half an hour. So we're going to keep her to that 30 minutes. No pressure, but let's proceed. Michelle, thank you.
Okay, how are you doing, right? Okay, so we're gonna go here. So I give you a little cleaning. All right. Ready to go?
Yep.
All right, let's do it. Okay. And you're all done. And let's get you a Band-Aid. I don't have a Band-Aid right now, so. All right, so you're good to go. Congratulations.
Thank you.
Okay.
Thank you very much.
Okay, you can pull your sleeve.
This vaccine is very meaningful to me. It's very important to me. As a nurse working in the emergency department here at Valley Stream, as a healthcare worker, seeing what we saw, people clinging on to life, death after death, having endured all at the same time, illness of my father-in-law, being severely ill myself, 36 days of my father being in the intensive care unit here. This vaccine is hope. It's hope that we will cease this pandemic. It's hope that we will live a better life. We should not be afraid of obtaining the vaccine. We need to be afraid of COVID because it definitely changes people's lives and it takes and destroys life. Thank you very much for the opportunity to be one of the first to get the Moderna vaccine.
Arlene, you'll take any questions if anybody has a question. If anybody has a question? Yeah. Well, I just want to say congratulations to Arlene, thank you. And what Arlene said was very, very important. It is urgent that we get everybody to actually get vaccinated. The vaccination process will occur now over the next number of months. Nursing home residents beginning right now as well. Healthcare workers, especially those on the front lines. And then this will progress through January, and as we progress into January and February, we'll be doing other essential workers. And eventually the high-risk individuals, older people at high risk, and then eventually going into people, to the general public. And this will take a number of months to do. And so one of the things that people should make sure that they do, and that is as we're entering the holiday season, end of this week, and New Year's, that everybody continues to wear the mask and social distance, because just because we have a vaccine is no excuse that people stop wearing the mask. We have to continue doing that for the next couple of months and probably for some period of time afterwards. So if we comply with all the social distancing, hand washing, mask wearing, and do the vaccine, then we have a great chance to see the light at the end of the tunnel of COVID. And so I would urge everybody to do that. And also, as what Arlene said, the vaccine is safe. It has gone through all of the proper processes to assure its efficacy. And we encourage everybody to get vaccinated. That is important because we need about 70% of the population to be vaccinated to get what they consider herd immunity. And this will take a bit of time, but everybody that is hesitant about the vaccine should understand that it is safe. There might be mild, side effects, tiredness, sore arm, but that does not mean the vaccine is not working. It actually means the vaccine is working. It is doing what it should do. So we encourage universal vaccination, and we encourage mask wearing. And so I want to thank Michelle, and I want to thank Arlene. Thank you so much. And with that, unless there are any questions,
let's throw some questions real quick, Arlene. You've had COVID. You're healthy now. You've recovered from COVID. Why was it important for you to get the vaccine today?
Do not want to go through what I went through. I do not want to go through what I went through in March and April. I was severely ill. I didn't know if I was going to make it out. I think that if I get it again, I will not. That's how severely sick I was, and I just don't want to go through that again. And I do not want to expose my family to my illness or to see me ill, or my family and friends, my loved ones, or my coworkers.
Now, you just had the vaccine, obviously an emotional moment for you. How do you feel?
I feel good. Of course, very emotional. This is history. This is hope that everything is going to be okay and it's going to be back to or better than before. And I feel good. No pain. Looking forward to what's coming next, which is hopefully a better life.
Don't forget the second dose, 28 days.
Yes, it's okay. I'm ready. I'm ready.
Right. Just mark that on your calendar. That's important.
I'm ready. Are you going to be here with me?
Oh, you ask, I'll be wherever you want me to be.
Can we mark it on your calendar? Thank you.
Good. Okay, thank you all very much. Appreciate it. Thank you, guys.
Thanks.